My name's Carlos Ramos. I came to Bioidentical Medical because I know Dr. Rivera from quite some time ago, and when she told me she's opened a clinic that deals with hormone replacement therapy and is working on all of this, type of beauty products and, beauty type of treatments and everything, I was definitely interested for some treatment I needed. The experience was great. Naturally, from knowing Dr. Rivera before, it was a very comfortable setting. Now, when I first walked in, instantly impressed. I think, I'm a decorum type of a person. I think the decorum was nice. The staff was excellent. What was most notable for me also is that the people who work here and the people who manage the treatments here, they really fit the part. They're people who take care of themselves. They're also people who seem, well nourished, well exercised, and I felt like that also gave a very good impetus for me to carry on with what it is they were recommending. So when I came to Bioidentical, it was kind of my Hail Mary moment because I was already going for a while. I'm talking about several months worth of not really being able to live my background. I've been a martial artist since I was 6 years of age. That's like, probably about 10 years of boxing, 9 of jiu-jitsu, and Muay Thai thereafter, and then I get this hospitalist job, and all of a sudden I'm not being able to make it till 4:30. Felt like I was falling asleep, getting very irritable. I was also having a lot of symptoms of fatigue and everything like that. And it just didn't seem like how I live. It didn't seem what I trained for. It didn't seem how I nourished myself. I felt like something was wrong. We have a way, when you're a physician, you have a way of being able to check your labs and check up on yourself. And I came to find out that I had a stress-induced drop in my testosterone. And I mean, I don't know, really why that would have even been an issue with me. So first thing I did was I called Dr. Rivera. I told her, listen, man, these are my testosterone levels and this is what's going on and I feel this way. And she told me, yep, you probably got a stress-induced drop in the testosterone. So come on in, let's take a look at it. And that's how I even came in here to begin with, to be honest. So spoiler alert, I have a very good understanding, in my opinion, of endocrinology in general, and I'm pretty well versed in testosterone and how it works. But when she told me, why don't you just do a pellet? I was like, a pellet of what? I really didn't know what she was talking about. I'm aware with how to dose injections and how to do injections, and to be honest, I was not a huge fan of going in that route. Even after you study all of this stuff, there's still kind of the theory of the misuse of it, and I just did not want to be in that spikes and troughs trap that you can get into with injections. So when she tells me, oh, the pellet is this thing about the size of a rice that we implant in your hip, in the fat of your hip, and it's like a slow delayed release testosterone that lasts 6 months and you don't have peaks and troughs and everything, I was just like, okay, so where do I sign up? And that's, once she told me that, I went home and I started reading about it and looking at how the pellets insert. And so you've got this bioidentical thing, so you can kind of get away from this traditional testosterone cypionate injections and that type of thing. And it's also something that was fairly easy, at least at that point when she was explaining it to me, to get done. And it seemed like something that would last. So once I read about it, on top of that, asked her a few questions, I was pretty much sold with at least the profile of what that meant, The pellet insertion was very smooth. I instantly felt we were dealing with very experienced hands here. I mean, she just kind of went through the process, didn't go back or forget anything. So I think the process of getting it inserted was very streamlined. Did it hurt? I guess I'll have to divide that up into while I was getting it and after I got it. While I got it, I think the worst part was getting the numbing agent, since they have to put a needle and then give you the lidocaine there. I felt kind of a poke there, which, just out of humor, I dramatized it for her a little bit. But after the fact, I felt fine the rest of the day. The next day, kind of, I guess, circling back to the martial arts type of aspect, I felt like I might have gotten a knee to my behind, and it kind of stayed that way for about 4 or 5 days, and then it just kind of teetered off. I think it was something overall very tolerable. Maybe like you got punched there, but it wasn't anything, that I had to take off work, or it wasn't anything that gave me any downtime whatsoever. It was very convenient to have, actually. So that, I think, was one thing that threw me off, because she told me, most people feel the effects of it within about a week to a week and a half. And at about 2.5 to 3 weeks, I felt nothing. I mean, I guess it was this thing like, I guess I felt like it was just gonna pop one morning and I was just gonna wake up and I'm like, I got my mojo back, so to speak. But then at about 2.5 weeks, I touched base and I'm telling her, hey, I don't know if this thing's having a whole lot of effect. She's like, no problem, let's just get your levels back. Let's redraw your levels and see where you're at. So I redraw the levels, and in the time it took for that to come back, I'm starting to feel a lot more energetic, a lot more endurance, and it wasn't a popping effect. It's not like something detonated in me. It was just kind of like I could pick up functionality if I wanted to because it was there and available. Gym workouts started getting plenty of endurance. In fact, I had to cut them kind of short even from what I'm capable of doing just for the sake of not overworking myself. I was staying up a lot longer, getting things done. I was sleeping better. I never had any urinary problems, went to the bathroom, but somehow that fixed even more. My mood was great. This whole irritability that's associated with hormone replacement certainly did not feel any of that either. And in addition to it, I found that I was processing my nutrition a lot better. I was making better use of protein, better use of fats, burning the carbohydrates, and it's almost like at baseline, my function it trimmed the fat. It made the efficiency of my functioning a lot better once I got it. If I could put it in a one-liner, it took away my old life and gave me a new one. I think that I think the most valuable thing I got out of it was being able to plan my day. When I know how much energy I can count on, how functional and how much vigor I can exert in a given day and getting things done, I can plan for things like waking up at 4 in the morning and going to sleep at 10:30 at night and packing a bunch of things into a day that I can get done without feeling that stressful, like overwhelmed type of thing, because it almost becomes this thing like you want to challenge and see how much performance you're really able to put out. I mean, I'm not the oldest person in the world. I just turned 35 yesterday, but on the other hand, I've gotten at least 35 years of wear and tear, living a little bit hard in life. And I honestly feel like I feel better than the 18 to 24 gap because I get to live the life and the lifestyle of a 35-year-old with the energy that I always remember having 18 to 24. That's something that I think was done very well. It gets into a little bit of a difference with Dr. Rivera and I because it's somebody I would communicate with, before I started treatment, and it's somebody I know from all the way back in residency too. So this was more kind of like a text message type of a thing, but I will say I've sent multiple people to come get treatment, and I'm talking about people with high performance lifestyles as well. And they have told me that, they're constantly, getting their texting right on time when they're supposed to. There's always an appointment available, even when they're busy. They're courteously treated every time. And there's one thing that really stuck out is with my Muay Thai trainer, he came to get some treatment done as well. And he told me that at all times there was somebody here with him, talking to him, available to answer questions. And in scenarios where somebody's got to go to the back and do something, somebody else was available to him. I don't remember ever seeing service like that in a clinic, to be honest. Oh, absolutely. I think the pellet hormone replacement therapy, I think, takes out the last couple of hesitations that people have with getting hormone replacement therapy, because a lot of what you hear all the time, you got to go on steroids, you have to inject yourself, you want to get your testosterone levels, you have to inject yourself, and we keep hearing about injection upon injection, and then first thing people do, everybody does, is they go on Google to go research what this is, and the first thing they see is hip osteonecrosis. They see hypogonadism, they see things like infertility, they see things like osteoporosis, and usually they show you some guy that looks like the Michelin Man as well, who's on this therapy, and everybody looks at that like, I don't want to be like that. And I think at large, from a medical standpoint, I think a lot of the problems that come with hormone replacement therapy is, first of all, them not being managed by an expert. And that was one really important thing, because Dr. Rivera is an expert. She is an endocrinologist, so a lot of this stuff is being pristinely tracked the whole time. But the problem you get with the peaks and troughs, where towards the end of that week you have to go re-inject, and you've got to take the other pill on top of that pill to avoid this side effect and everything. I think a lot of that is wiped clean when you do the hormone replacement therapy with pellets, because it's a time release thing, and you take 1 or 2 supplements to just kind of help the levels stay, and then as you monitor them, they're very steady. So absolutely, it's something I could recommend. This is something that improves quality of life exponentially. Because number one, you don't have another medication you have to take, like you're, you know, a diabetic needing insulin on a weekly basis. And on top of that too, you don't have to constantly be trying to book another appointment because a new side effect you don't recognize happened. This is something that's very easy to manage, and it's something that you just get the pellet put in, you deal with the bruising pain you've got for a couple of days, and you move on with your life for the next 6 months. And I'm talking about, and you move on with an improved level of life, not just keep trekking through it and hope your blood pressure got better, you know?